Entrepreneurially Thinking is a presentation of BioSTL and CET, Center for Emerging Technologies, with RareGem Productions, changing the way you view new ventures, including you on the pathway to success with your business in the St. Louis marketplace and beyond. Here's your hosts, Cheryl and Christy. Now let's get thinking entrepreneurially.
Welcome to Entrepreneurially Thinking. Our goal is to invigorate your entrepreneurial mindset and create pathways for business success in the St. Louis marketplace and beyond. I'm Christy Maxfield, Director of Entrepreneur Development Services at the Center for Emerging Technologies.
And I am Cheryl Watkins-Moore, Director of BioSTL's Bioscience and Entrepreneurial Inclusion Initiative. Hey, Christy.
How you doing?
We are back again.
Yes, indeed. And once again, stepping outside our comfort zone. So this podcast is here to help you step outside of yours as well. We invite you to join us and begin to think about your business in new ways. We want to take the constraints off of how you view your new endeavors. You can stay connected with Entrepreneurially Thinking on all of your favorite streaming platforms, Facebook, Twitter, LinkedIn, or visit our website at entrepreneuriallythinking.com or follow the hashtag ETHINKSTL.
Well, today, tighten your seatbelts because we have two ladies here that are outstanding in the home healthcare marketplace here in the St. Louis market. They're going to be speaking to us about some of the trends and opportunities in this industry, which I think are phenomenal.
Yes.
We'll be learning from these entrepreneurs who found success in this space, and we're excited for them to share their stories. Joining us today are Dacia Betts, owner of Integrity Healthcare Services, and Ada Joyce Taylor, owner of Deer Valley Home Health Services. If you guys haven't seen those commercials, I don't know what's going on.
Yeah, you're just not paying attention.
Exactly. So we'll be getting back to these ladies in just a minute, understanding and finding out more about the industry and their journey when we come back.
Now here's Make It Happen with Keith Sales Pro.
As we enter into the new year, are you looking to make a career move or just find a new job? Oftentimes, when looking for a job, we look in the usual places, newspaper, online, websites, etc. No. Look in your personal Rolodex. Yes, friends, family, and your personal contacts. Let them know, I'm looking for something new. I have friends that have never looked for a job. They were so good at what they knew that others recognized their body of work and offered them new opportunities. Your place of worship, fraternity brothers, or sorority sisters are also great people to share with your ambition to find new opportunities. Today, remember, it can happen. It will happen. And together, we will make it happen.
Follow Keith Sales Pro on Facebook or Twitter at Keith Sales Pro, or visit his website at keithsalespro.com.
It can happen. It will happen. And together, we will make it happen.
Dacia Betts, CEO of Integrity Healthcare Services. My thoughts for thinking entrepreneurially is that vision is key. The sky is not the limit. Go beyond your wildest dreams. Make it happen. Take no excuses. You can make money or you can make excuses, but you can't make both of them at the same time. That's my motto.
So now that you're glued to your seat, we're going to get started. Ada, could you tell us how you got involved in owning your own business, your own home health care business?
Well, it's basically started when I was a teenager.
Really?
Wow.
When I got out of nursing school, I went to a nursing home, and I worked there, and I fell in love with gerontology, and ever since then, I've been working with the elderly. I bought a piece of property in 2003 at 4045 North Highway 67 to build an assisted living. At that time, we called them our residential care tools.
Yes.
And it was a home for seniors, old people, okay? But now, as things have changed and we see more of a need now for Alzheimer's care, we're building a standalone 20-bed Alzheimer's unit.
Wow.
Right.
So this started when you said a teenager.
Right.
You had a vision that you were going to be owning your own business.
Right.
And
Now the assisted living was plan A, and then the home health was plan B.
so you had a vision and you knew how to stage it. Wow.
But did that actually turn out? Did you, plan A was the...
No, we had to go back to plan A because we ran out of cash. As a matter of fact, we're in the process of trying to get back in the game with the CUP now.
And what's a CUP?
Conditional use permit.
Okay. But this is just the latest in a very long career in healthcare.
That's right.
And like you said, you started with a plan A and plan B. You kind of flipped, probably implemented plan B first, went back to plan A, and
I implemented A first, but it didn't work out. We ran out of money. So we had to,
So really you went to plan C. Exactly.
I went to plan B, and then that was the home health, and we kind of got stuck there.
This is what we talk about with pivoting on your plan.
Right.
There's always different ways to go about achieving your goal, and sometimes it doesn't go quite as you thought, but there's always a different way to go about it.
But as a visionary, you have to always understand things may not go just the way you want it to go, okay?
As an entrepreneur.
But we can stick with the industry, okay?
Absolutely.
And keep it moving, see? And as long as you keep moving toward that goal, you haven't really lost anything.
Absolutely.
Absolutely. Wow.
And Dacia, you are a bit newer to the industry.
Yes.
But also saw opportunities for growth. So can you tell us a little bit about your journey?
Did we say pivot?
She has a long journey. Prepare yourself.
Pivot?
Yes. We love pivots.
Exactly.
I've always admired Deer Valley, right? So I'm sitting here like,
I know there's an energy in the room.
We're with the queen. We're with the queen.
We're with
here.
the queen. This is the queen of home
I have
health.
no doubt.
Absolutely.
Right? But I'm a little different. I started in the financial realm.
Really?
Yes, I was a financial advisor and then moved over into the mortgage industry once my husband left.
That's okay. That's a pivot.
That's a whole nother story. But when he left,
We love stories.
Yeah, he left. Yeah, that was
He left. Okay.
He left.
And then you did your thing.
And then I went under. I've always had mentors in anything I've done. So one of my very good friends, Linda Alexander, was the only African American that I knew at the time that had 2 commas in her net worth, and she owned real estate and mortgage companies. So she took me under her wing. I opened my own mortgage company within a year. We flourished until the market crashed.
I was going to say the recession hit.
And it hit, and then I had to pivot again. And so at that point in time, I looked at where the economy was, and I saw that workforce development was huge. And there were people that became out of work who were successful in, IT and healthcare and things of that nature. So what we did is we ended up opening a school, Institute of Technology, for the 3 emerging employment sectors at the time, which are healthcare, IT, and renewable energy. So,
wow. And that was here in St. Louis?
That's here in St. Louis. And
fantastic.
I love it. So, we've been able to put people back to work. We get them trained. And that's how I really spun off into the healthcare, is because I always believe that you have to start with the end in mind. And with the end in mind being, I don't want to train a lot of people and not have them employed.
Yes. I totally understand that.
So with my daughter, at the time, was going into nursing school. She has since changed to human services, and I'm still trying to get that. Being that I've opened 3 healthcare companies for her.
That's okay. She'll come around.
Exactly.
She'll come around.
Yeah. So, she told me that 2 weeks ago. I'm like...
But that's what we train our kids
and
for,
she'll have an MBA 20 years from now, and she won't even know how she got here.
Exactly.
So now that, and then my mom also owns a shelter for homeless veteran women.
Oh,
wow.
So that's how we got the spin. I don't really want to come in and reinvent the wheel, but I've always believe that I had to have some sort of a competitive edge or just something a little different that I do. And what we do is we focus on veterans.
That's amazing.
So we provide free free in-home care for veterans.
And is that the Integrity Healthcare Services piece of what you do?
Yes.
Fantastic. Fantastic.
How long has that business been open?
Oh, honey, we just opened that this year, And
brand new.
Yes, we are excited. But through that, we've developed a lot of partnerships, and we too are partnered with another company that, are in the process of seeking property for an assisted living center as well.
So talk to us about home health care, because I think
growth industry,
yes,
one might think.
It is.
What is home health care for a lot of our listeners who might be sitting in the financial sector, might not know too much about home health? Talk to us about what is that industry? How has it changed? What did you see as opportunities?
The queen.
I really
the queen.
saw. Thank you. I really saw the change taking place from hospital to home, because it really costs a lot of money. Okay, to take care of people in the hospital. And I guess now the trend is they don't really want them in the hospital at all.
Right, exactly.
They sure don't.
Okay, so
High cost area to treat folks, right?
right. So with that in mind, my vision appears started changing a little bit too, and so I said, well, I said I want to do something in the home that can benefit the families, and that's how I got off into consumer-directed services.
Well, I think, too, the
Matter of
insurance
fact-
companies, too, like you said, they'd
Right.
rather pay for that care to be done in the home versus in a high.
Oh, right, yeah, it's about 50% less in cost.
That's amazing. Can you tell us a little bit about that consumer-directed healthcare piece?
Consumer-directed services.
Yes.
It is a personal care service program that benefits the family members that take care of family in the home.
So actually provides
Okay.
an income for that primary caregiver
Right,
who is
right,
your
right.
mom. It could be your
Right.
sister. It could be your
Right.
cousin or your aunt
Right.
or your uncle.
We're always doing something to make it better, either through raises or pay cards. We pay a huge amount of taxes. The taxes last month, they were $500,000.
Wow, which means that business is good.
Oh, yeah, business is good. But
Praise God.
we
There you go.
we have to pay those taxes.
Yeah.
But we also do personal care services. We do VA. And one of the reasons why I ask you for your information is because we had a client call this morning.
Is what this
We're
whole-
creating a
we're
synergy
creating
as
partnerships here.
We had a client this morning to call and ask us if we did VA, and I told her yes. Right away, the marketer went right on out to her house and got the information.
Well,
on
you know,
something we
fantastic.
needed.
that's what we like to do is put people together on this show. So maybe
Right.
there's an opportunity here.
Yeah.
Yeah, for me to help the queen, that is too cool.
Yeah, well,
That's too cool.
we always have veterans coming in
Yeah.
asking
Absolutely.
for.
Well, and it's a very competitive landscape, and we're
Right.
always talking to our listeners about understanding your landscape. Dacia, you had talked about the differentiation piece being a really important
Right.
piece of what you do. When we're looking at our market and we really want to make sure we are meeting unmet needs, in addition to the vets, what else are you seeing out in the marketplace right now?
You see a lot of people with Alzheimer's disease now, but the problem is, well, here's the thing. Your 85-year-old and older group, they're constantly growing, and some of them have regrets about the fact that, hey, I'm in good physical health, but my mental health, and they either have Alzheimer's or they may have dementia. You don't have a sympathetic public out there. So one of the things that we've been doing for the past year is educating people. Okay? Our whole agency now is engaged in what's called person-directed care or person-centered care.
Yes.
Okay?
Yes.
And Alzheimer's is a growing problem. It's the number one health
Yeah.
care problem.
Yeah.
Someone in their family has somebody that's suffering from Alzheimer's. And I think what your organization does and what many of these home health agencies are going to be faced with is how do you care for that Alzheimer's patient? My mother is an Alzheimer's patient. My father is 83 years old trying to take care of an 80-year-old patient, but he wants to keep her in the home. And when you look at, just home health or nursing home health, we need to come up with opportunities to make sure these
You have to
patients
get
can
away
be
from
cared
nursing
for.
home. See,
Yes.
the problem with nursing home, if you're unfortunate enough to have to put your parents into a nursing home, keep in mind they're going to have to take their assets.
Absolutely.
And that means that the family members, when they pass on, will not have those available to
Right.
them. And see, that's one of the things that you want to, keep from happening.
Right.
Okay? The other thing is, even though the people are getting older and they have Alzheimer's, there is no Alzheimer's funding through the government.
Absolutely.
Okay?
Right.
Yep.
Now, the reason why I keep searching and looking for ways to make sure that our clients and things are taken care of, and it takes money to take care of people. We've come up with the diagnoses that we have. The people that are diagnosed basically bipolar, 90% of them will come down with Alzheimer's. Okay, so we have a number of those. And by using the secondary diagnosis, that will pay for your assisted living, okay? The main thing you need to know, though, is this. You can get a grant for Alzheimer's, but $260 a month is going to go very far.
Yeah.
If I'm out here listening to you and I'm thinking about maybe home health care is something that I might want to open up my business in, what do you think? Are there opportunities here for new providers to come into, or are there different areas within home health care that maybe they can
what
target?
I would say do now, the best thing to do is look at the problems in the system. Okay, and see how you can solve them. Basically, about 3 years ago, we found out that there were very few DMH providers.
Hey, we don't know what DMH is.
Department of Mental Health.
Okay,
providers. The contract is rather long. You do have to have staff available that's able to do the job, and we do have that. So we have applied for it. We should be hearing something any day now.
So it sounds like what we always talk about with many of our new businesses is you have to understand the market.
Keeping an eye on
where the
market,
opportunities are.
Understand your demographics. Know your industry. Okay, if you know something is going on that people haven't crowded, or got anything crowded down here about, then go for it.
Competitors,
right? And assisted living is one of them. Matter of fact, there are no freestanding assisted living for Alzheimer's in North County, period.
Wow. Oh, my.
There are no hospice standalones.
Yep, that's my goal.
Wow.
Okay? So one of the things you may want to look at is hospice. Yeah, we're partnering with a hospice company now.
So it sounds like you're looking at different partnerships and how to grow your business.
Yeah.
Dacia, how are you looking at? We talked about how you came from the financial industry into now you're providing home health care for veterans.
Yes, ma'am.
Tell us more about your company and the other companies that have spun off from what you're doing.
Sure. Well, again, that's why I love listening to the Queen. But, as it relates to some of the gaps in home care, veterans is actually one that I spotted.
Yeah.
And what we do is we have the ability to take those veterans, and instead of them going through that 8-9 month approval process, we get them vetted, and then that following month, their in-home care is free.
Wow.
So we turn all of that done.
Wow.
So that's one of the things that we do. And again, and then I'm also partnered with a company that hasn't made me inclusive in their assisted living center project. So I'm really looking forward to that because I'm a grandmother's baby, right? And I have a 91-year-old grandmother who still lives alone. And refuses.
Right. I get that.
So, I mean, that's one of my passions as it relates to the elderly. I understand that the baby boomers are now growing into that phase. I also understand that my maternal grandmother was an Alzheimer's patient and was in a nursing home. So those types of things hit near and dear to me. So that's kind of where that's where my passion came in. Not to mention that my daughter, who was supposed to be a nursing student, who changed her major.
I hope she's listening.
Oh, my gosh.
I hope she understands that this had business implications.
Yeah. So.
But you also, I wanted to go back just a moment. You spotted a trend even before getting into the direct provision of healthcare, and you created a school, which is not a common route to entrepreneurship.
Right.
And you created a school for 3 high-growth potential industries. Can you tell us a little bit more about that and why that approach seemed to be ripe for opportunity for you?
Sure. Well, as it relates to workforce development, which is, of course, the core of my passion here, because, when you come to a point of making a really good living to everything being snatched, you understand that, hey, there's some missing gaps here.
Yeah.
I didn't want a school to come in and train individuals to work for $8, $9 an hour. My goal was to get those individuals into a high growth employment sector, such as healthcare IT, information technology, renewable energy. Why? Those are the jobs of the future.
Absolutely.
It's technology time, people. So that was my core. The other companies spun off from there because, again, I understand that there's always going to be a need for in-home care, right? that's a passion of mine. We want to make sure that individuals are taken care of. But in my case, I was really focused on veterans.
Yeah.
Why? Because my school is focused on veterans. My companies are hire veteran heroes type companies. So we are recognized for hiring veterans.
So do you have military in your background?
Not at all. Not at all.
But you saw the opportunity.
But I saw the opportunity, and it all kind of came from my mom. You know, she owns a shelter for homeless veteran women.
So you had entrepreneurship in your family from your mother.
She got it from me.
Oh, I like when it goes the other way.
That. I love that.
I also wanted to just touch on with Ada. You were thinking of this business back when you were a teenager. Did you have entrepreneurship in your family?
My mother was a tax preparer.
Okay.
Okay. She worked at the laundry for years, and I sent her back to school to get her her ability to do taxes. And I do know some things about taxes. I know that if you don't want those penalties and interest, you better pay them on time. Honey, $250,000 or $1 million, whatever they are, you have to pay them on time.
But again, seeing opportunity and kind of actually influencing.
But now, the healthcare IT that you're doing, that's most important. I've always believed in in-house. We don't outsource anything. And basically speaking, like I was telling them, the IT is getting to be big business there. At the home health, it's like we can't do without it. So if we can't do without it, then we're going to have someone that knows something about it.
Fantastic.
So Ms. Ada, it sounds like you have been integral in your business, even as you've grown the business. You're still involved in your business and growing it.
We just did a restructuring. The reason why we're doing the restructuring is because we know that we can get people to be more productive if we focus them in on exactly what it is we want them to be compliant about.
Yes.
So how big is your staff? Just curious. I mean, how many people do
Office staff is 32. That's with 6 nurses, though. Okay.
And then overall, you said just office staff.
Right. We've basically done away with the administration until, we can kind of like regroup. Right now we have an interim administrator, but she's going to be going to the assisted living. Okay. And we have a compliance officer now.
So you still have a lot of people that you're managing.
Well, yes.
Yes.
A lot of people to manage.
And the industry has changed over the years.
Yes.
We have a lot of auditors and billers. Okay.
Exactly.
We changed the name of the coordinators to risk managers because that's basically what you're doing. You're managing the risk and putting out the fires.
Absolutely.
Okay?
Well, identifying those opportunities is crucially important, but also dreaming big is an important part of what we're going to do. So we're going to take a quick break and then talk a little bit about how you actually are that visionary.
How can our listeners begin living their lives with focus on their physical, mental, spiritual health?
Just developing a daily practice. Make a list and decide these are the things that I'm going to do because I know that when I do these things, I feel better. I would definitely recommend finding something that's uplifting or motivational that you can read or listen to every morning. We have no control over what happens once we hit the door, but we can prepare ourselves so that when we do encounter whatever arises, we're in a better emotional and mental state to deal with it.
Learn more at aliveandwellstl.com.
My name is Ada Joyce Taylor, and I am the owner of Deer Valley Home Health Services and Old Henry Restaurant. This is the way I view my industry is change. I always tell people you don't know everything because the world just changed 5 minutes ago. So you can't know everything. So you have to get out there and continue with your learning so you can continue to earn.
So we've hit a few themes, mentors being incredibly important, family influencing each other, going both ways generationally, and family experiences really informing some of the choices you've made about the businesses you build and the people you serve and how you're actually creating opportunities and wealth in the community. I find that to be particularly important to just bring our listeners' attention to.
And also the attention that these are 2 African-American women. If you don't hear that through the radio, folks, this is what I'm so proud about.
Yes.
Is that we've got the queen of home health care.
the queen.
And we've got the rising princess right here.
Oh, I like that. But what it means is that over a long period of time, there's been a lot of opportunity.
Right.
There's been different ways to enter the market. There are still lots of different opportunities to be had. And so one of the things we often find is that entrepreneurs often think about what they can do personally. Like, if I'm an accountant, I can do accounting. If I'm a marketer, I can do marketer. If I'm a nurse, I can nurse, right? But you both have built companies that go way beyond your personal capacity to do it.
Yeah.
And how did you have that? How did you have that vision for what you're doing?
Well, for one thing, keep it in mind, it's a learning experience in itself. And what I would do is I would take care of the office maybe 1 or 2 days out of the week because I was still, working. But I would always make it my business to get out and network.
You all hear this, right? I think we preach
and
this
she
all
was
the
working
time.
her day job while building her vision.
I always
Another
say,
important
if
thing.
you're
Make
not
those
networking,
calls.
you're not working.
Right, make those calls on Thursdays and Fridays when people are being discharged. And then I found that if you get your clientele like ahead of time, okay, and know that you're able to service these people.
Well, how did you build your clientele? Because you
built my clientele strictly through advertisement, footwork. We go, we market all the time. We market all the time. The intake coordinator, she's got some marketing events set up.
No, but I mean initially when you first started this business, you were out there
marketing, talking to people, talking to churches. I still go to some churches now. We don't contract with the marketer anymore. We tried to do that again this year and it didn't work out.
So you were doing face-to-face. We just had an episode where there was another healthcare provider who built his business by being involved and going out to the churches and getting their message out.
That's
that
what you
way.
have to do. Yeah, right.
So Dacia, what's your take on, and what has been your vision as you were building your business? You talked about mentors. How have you built your business?
Well, I'm getting ready to scoot closer over here to the queen, but what I've done and everything I've ever accomplished in life has been have a mentor. I've got a mentor who's one of the heads at the state, so that I understand contracting and so on and so forth. I had a mentor with my financial realm, with the school. My awesome mentor is Benjamin Akande.
Wow.
You just don't get any better than that. I also opened, because again, my daughter, who was supposed to be an RN, I was, going to open a medical spa for her. And so what we did, we started with hair replacement systems, and we want to service those cancer patients, lupus and alopecia patients, and so on and so forth.
So you still have that?
Oh, honey, I started that, but Hans Wyman. I met with him, so he's kind of working with us, and mentoring me on that. So all I'm saying is go for the best in the industry, sit under them, learn what you can learn, and then make them proud.
Yeah. One of the made me think of Amy Dunn from Prosper Women's Entrepreneurs, and she also does a lot of work with her own consulting company, came in recently to Square One to talk about networking. And she referred to folks like Hans Wyman and Benjamin Akande as, for many people, aspirational contacts.
Absolutely.
And that you've got to, you've got to put the queen's name on your list and want to meet her if that's part of making your vision work.
I hear her talk about reconstructing. You may want to know that rehabilitation is really big business now, but what it is the people are relying on the insurance industry to pay for it, when basically speaking, the insurance companies are trying to get out of it. But one of the things that you can do is this. Along with the assisted living, we was going to do a rehabilitation, okay? Now, so that you will get, the funding that you need for it, you need to sort of like get with the company or get with somebody who knows those needs that being met, like wigs and hair replacements, club fitness, or have someone that can, work out with other people, have, some equipment, for people to work out with.
It sounds like going back to what you said and Dacia is doing, living that, is getting with people who understand the industry, who understand the market, that can help you as you're building your business. And I think
help you seize opportunities.
Absolutely. And those are real competition exists in everywhere you are, but I think for those folks who are comfortable with themselves, they don't see you as a competitor. They see you as
a value add.
Absolutely. Right. Absolutely.
Now the problem with rehabilitation right now, let's say, for example, mom breaks her hip. Now, what Medicare does now is they take it from a larger perspective. Now, they say, well, how much does it cost to repair this in Vietnam? So if we're repairing it for $600 in Vietnam, how come we have to have, $8,700 in the U.S.
Well,
to
the
repair
healthcare costs are totally
they're
different,
looking at the costs, okay? So...
So with all those challenges, did you ever think you couldn't do this?
Well, yeah. But see, here's the thing, okay?
Well, what made you stay? What made you stay?
Hey, you never say you can't do something.
That's right.
It can be done. That's what I'm trying to tell you now. There may not be big money in Medicare rehabilitation, okay? But as far as the private pay part of it goes, yeah.
So always finding that opportunity, even when it looks like it's going to be a dead end, really.
And believe it or not, I think you could do quite well with that, because see, you got your spas, you got your, your gymnastics, you got your health and beauty, your wellness that you can deal with.
So there's different opportunities in here.
And women, breast cancer is a big one.
Right.
So you may want to work with them with reconstruction.
So let me ask you guys are, I had mentioned this before, 2 African-American women, which I think are unique in building businesses in this area.
Particularly of scale.
Yes. What have been some of your experience unique from the African-American perspective, that as you were building your business, what were some of the opportunities that you faced? What were some of the challenges that you faced, and how did you move forward? Dacia?
Well, I mentioned, I deal somewhat with the state of Missouri, and I networked before anything for a very long time with the state, and I even had a contract at one point where I was getting the MBEs and WBEs, which are the minority-owned and women-owned businesses, certified with the state. And not only do I get them certified, but I've always consulted and trained and let people know the benefits of being an African-American woman in business. So what I did was I utilized that as my advantage.
That's fantastic.
Right. So that we can work not only on contracts, because right now I do have a staffing company too, but right now that staffing company has a contract with the state where we do all the paternity testing for the state. So, it's those types of opportunities that I've been able to seize. I didn't go for the contract, but they just found my name. And, of course, when you have a good name up there, then you'll be referred.
Absolutely.
Right? So those are the things that I did as a African-American owned.
Any obstacles or any barriers that you faced?
I don't own barriers. Barriers are my motivators.
There you go.
The best thing to do is,
Love it.
we know the enemies are out there, okay? You have your haters out there.
That's right.
We know about them, okay? But here's the thing, you have to kind of dust it off and keep on going.
Keep it moving, right?
It's nothing really that you can do about it. Sometimes you may have to, get a little nasty with some people about some things, but
explain it to them how the world is going to work.
Sometimes you run across some difficult people, and I don't like sending out 21-day notices, but I'll have to do that if we can't come to an understanding.
Well, what's so funny is I always look at Harriet Tubman. I mean, you look at how she faced many obstacles, but she still kept going back and moving forward.
Yeah,
so if she can do it, I believe we can all do it.
And see, here's the thing: don't think that because you're an African American female, that you're the only one that has problems.
Right.
Okay. To see,
Good reminder.
Hey, the best. I'm a big reader, and I like to read other people's trials and tribulations and what they had to go through to get from point A to point B.
Yes.
And believe me, it was no picnic.
No,
Absolutely.
What I really see in you is you're constantly taking in information.
Right.
You're
Oh, yeah.
constantly finding new connections out there. And if you were here in the studio with us, you would see her mind is just going 100 miles an hour, thinking about what she could do with or for Dacia, thinking about how all the changes in healthcare are intersecting.
Yeah.
I mean, she could help us build 5 businesses here if we just let her riff.
I'm looking at both of these women. You all have had, I mean, Dacia, I don't know when you sleep because you mentioned like 3 or 4 businesses plus the school that you have.
A very good team.
So tell us about your team, because I think that is important. You talked about mentoring, talking about how did you build your team and what do they do for you and for your organization?
Gosh. You know, I am so blessed. I mean, my school, thank God, it's online. You know, so my instructors, phenomenal.
Okay.
But I forgot to mention one of my favorite mentors, which was Tim Slater. I met Tim Slater through Father Support Center. We had a meeting. And Halbert's also one of my
Good people.
Oh, he's awesome. But Tim Slater, the owner of New Horizons Computer Learning Center, as well as Calc Institute of Technology, let me come in. He took me under his wing. I worked with his school, you know, and placements. I worked in compliance so that when my school was finally approved, I had the ins and outs. He is phenomenal. But it's people like that that have helped me, you know, build the wherewithal, you know, both mentally and physically, you know, on what to do and what to look for in a team. My team in every business is my driving sector. They take me out of the equation in so many facets. I mean, I'm there. But, you know, when you can work on your business and not in it
That's
all the
hugely
time,
important thing.
that's my whole goal. That's my whole goal. Right. So, I mean, and that's also a part of my exit strategy. You know, I've got 9 years left. You know, in 9 years.
9 years left. What are you going to do? You going to, there's a island?
I think Tahiti.
Yeah, I was going to say there's an island in your future, right?
Well, you always want to relax as you're going towards, you know, your goals.
Right.
So instead of waiting until you say the end, keep in mind, you know, healthcare has no end.
Well, see, my daughter, who was supposed to go to nursing
Oh,
school.
honey,
People can disappoint
I hope
you.
you will listen to your
People can
mama.
disappoint you. So I'm telling you, they will disappoint you. Trust me.
But she's going in human services, so we're going to keep her over the realm of the in-home health. But
There you go.
But that's a good point, that there is no end. So
Learning never ends.
making time
Learning
along the
never
way
ends.
to really
Never
enjoy
ends.
the fruits of your labor,
Right.
knowing that you're building something not only for
my
the future,
children.
but
I took
for the today.
I took an 18-day vacation for the first time in
That sounds amazing.
wow, because I haven't had one in
11 years.
Wow.
Right.
Yeah, I can believe it.
And I had never gone to the West Coast before. I went to Seattle. I went to Alaska. I went to Canada.
Sounds wonderful.
And then I came back, and we went back and spent another day in Seattle because we wanted to go to the market down there. And then from there, we went to San Francisco.
Ooh.
And
Awesome.
the houses in the
The
hills.
smile
I don't think
on
I
this
can
woman's
live
face,
there,
those
but
18 days were
I
amazing.
enjoyed it. And then we flew to Honolulu for my daughter's wedding.
Oh, my
she got
goodness.
married in Sherwood Forest.
Oh, how nice.
And, and then we came back to Las Vegas. I had never been to Las Vegas.
So see,
And
They're beaming. To say that
She's
she is beaming is an understatement.
yeah, and I loved it. I really had a good time.
I think
really did.
what both of you all are saying, you love what you're doing. You're working your businesses. You got great mentors. You've got a great team that can help support you, and you are actually enjoying what you do.
Right.
And that's huge.
That is
There
very
is no end in sight. There isn't.
Miss Ada, there
And she
no-
says
you're
that
right.
with
There is no
the
end in
enthusiasm
sight.
of a woman who sees opportunity around every
right,
corner.
right. There is no end in sight. There really isn't.
So Ada, where can people find you
Yes.
if they're looking to to learn more about your business,
They just need to turn on the TV.
8600 Airport Road.
Turn on the
Come to
TV.
8600 Airport Road.
Fantastic.
Right.
She's got
You
commercials
can knock on the
going
door
all the time.
and
true.
find her
That's
right
true,
there.
yeah.
And Dacia, if I'm interested in the school or in the home health care piece you're doing or in the staffing or really just any of the enterprises you have your fingers in, where can we find you?
You can contact me at 888-690-7911, and my direct extension is 5. Would you like my websites?
I would love your website.
Both of you guys for your websites. Yes. Dacia, what's your website?
You can reach me at integrityservices.healthcare and then tech-institute.com.
And Miss Ada, what's your website?
DeerValleyHomeHealth.com. Now,
Right.
you do know I own Old Henry Restaurant as well.
That's you too?
You own that? Because my cousin's upstairs from you. At
Oh
the,
my God.
She's in the hair. She has
St.
that
Louis people.
boutique upstairs.
Right. Have you ever been there before?
Okay.
Well, I think I've seen you someplace before.
Well, thank you, ladies, for joining us. It is
Yes.
really a pleasure to get a brief moment into your brains. The wonderful minds that are seeing opportunity for business growth and development in our community, and really inspiring others to do the same. So, thank you for joining us.
Thank you guys so
Thank you for
much.
having us.
Thank you.
Thank you so much.
Thank you.
Changing the way you view new ventures, igniting your thinking about entrepreneurship. It's entrepreneurially thinking. Get connected and discover more. Visit our website for show notes, resources, information about our guests, upcoming events, and of course, all your favorite episodes. If you have any questions, be sure to leave them for us in the comment sections, and be sure to leave us a 5-star rating on iTunes. The best way to show love is to share. Let everybody know that you're thinking entrepreneurially. So visit our website, entrepreneuriallythinking.com. #ETHINKSTL. Entrepreneurially Thinking is another positive production of RareGem Productions. Thanks for listening.